It's a pleasure for me on behalf of the ReCONNET team, coordination team, to introduce this very interesting and important webinar with Professor Giuseppe Turchetti and Gelareh Emami. They are person from the Institute of Management of the Scuola Superiore Sant Anna, and we are working with them with many activities also regarding European Reference Network and ReCONNET in general. We are collaborating from a couple of years on organizational care pathways, and we developed together a specific methodology called the ReCONNET path on the organization on patient's care pathway. And since we developed this methodology also before and during the pandemic, we are applying also now. We experiencing several problems in the organization of health system during the pandemic. And so it is important for us as clinicians and patients representative and other stakeholders to talk about difficulties and also resilience in the health system. So it's a real pleasure to introduce Professor Giuseppe Turchetti and give the floor for the webinar. Thank you.
Thank you so much, Sarah. Good afternoon to everybody. It's really a great pleasure to be here this afternoon. As Sarah was saying, was anticipating, we belong to the Scuola Superiore Sant Anna, to the Institute of Management of the Scuola Superiore Sant Anna, that is a university based in Pisa, Italy. Our group is very much involved in the health economics and healthcare management studies. So we have a multidisciplinary group that is made of course, by economists, by people, experts in healthcare organization, but also by pharmacists, biomedical engineers, by philosophers, by medical doctors. So it's really a multidisciplinary group. We are very much involved in the study of rare and complex diseases since many years. Now, and the opportunity of the ERN program has been really extraordinary for all of us. In fact, we have collaborated with the ERN ReCONNET since the very beginning of the program, but over the years we have collaborated and interacted with many colleagues belonging also to many other ERNs in Europe and also with the European Commission. Our effort has been finalized and focused on different directions. Of course, healthcare economics analysis and organizational analysis. But just to give you an idea of the work that we have done so far, and actually our lines of research that we are still nourishing. The first has been to try to analyze if the current economic assessment tools that we have available in our tools, in our methodologies, really fit to analyze the very specific conditions and the specificities of rare and complex diseases. So we have brought this kind of analysis on the table, trying to also innovate, promoting some specific methodological tools able to better take into account the specificities of rare and complex diseases, of course, with respect to the economic analysis. Then we have focused in the last years very much our attention to the organizational dimension. And as Sarah was anticipating, we have worked on the definition of a methodology that is named ReCONNET path for the analysis and design of patients' care pathways. And this is also in response to the invitation of the European Commission that in the statement of June 25th, 2019 on the integration of the ERN on the healthcare systems of the member states clearly suggested to work on this area, so the adoption and design and adoption of patients' care pathways. So we have developed this methodology that has been applied in several diseases in ReCONNET, and now it is more and more applied also in other diseases belonging to other ERNs in Europe. Now, what we are focusing on and what we are presenting to you today is another step of this journey that is related to the concept of resilience of the healthcare system in the context of rare and complex diseases. Our objective is to try to find out if there are specific determinants of this very important dimension, of this very important condition, resilience, during crisis, during emergencies. We all very well know that rare and complex diseases have a lot of specificities. So it is really very important in order to build a system that might be ready to manage and to cope with future possible crises. We have to be very aware of which are the determinants, the most important determinants that may help the healthcare system in being resilient in the context of rare complex diseases. So this is the objective. I leave the floor to Gelareh. She will present to us the rationale behind and the objective of this study. At the end of the presentation, there will be a link to a survey, and it is very important that all of us, all of you, could contribute in filling this survey, because the idea is to build together, starting from your experience in the last 2-3 years, in order to define which are the key elements, the key determinants for the healthcare system resilience in the context of rare and complex diseases. So, Gelareh, the floor is yours, and thank you, everybody.
Unfortunately, I cannot share my screen, as it seems it's blocked. It's disabled.
Yes, Diana, if you could.
Probably Simone can unlock and able to share also. You cannot share, Gelareh?
No, it's disabled.
Okay, let's try in another way.
Now I can. Okay, can you see my screen?
Yes.
Yes.
Okay. Okay. Good afternoon, everyone. I'm glad that today I'm here to present the result of our research. My name is Gelareh Emami. I'm a last year PhD student in Scuola Superiore Sant Anna at the Department of Management. Currently, I'm working in the health economy group under the supervision of Professor Turchetti and Dr. Lorenzoni. In this project, we have a collaboration with ERN ReCONNET in Santa Caterina Hospital, Pisa, Italy. For those of you who are not very familiar with this concept, first of all, I will give you a very brief introduction about resilience, and then I will cover and go directly to the reason of this webinar, which is resilience in rare and complex diseases. The term resilience has been part of terminology of many fields, such as physics, engineering, economy, ecology, psychology. For example, in physics, We call it the ability of material to absorb dynamic forces. In ecology, they define it as the ability to absorb change and disturbance while maintaining the same relationship between population and state variables. In general, resilience is the capacity of an individual population or system to absorb a shock while still retaining the fundamental function or characteristics of original state. But what about in our field, health system? Literature shows that many critical events could put pressure on the health system, such as financial crisis, migration, climate change, natural disaster, infectious disease outbreaks. But 3 historical events highlighted the importance of resilience in the field of health system. First, European sovereign debt crisis. Second, Ebola, and then COVID-19, which we were facing just recently. But what is the resilience really in the healthcare? Based on the definition of WHO, this concept is defined as a capacity to absorb, adapt, and transform when exposed to a shock, such as pandemics, and still retain the same control over its structure and function. In this definition, I want to highlight 3 main concepts. First, capacity to absorb, adapt, and transform, that we know it as a characteristics. Structure and function, that is known as performance, and shock. During my presentation, I want to talk more about these 3 concepts. First, shocks. Any internal or external force that can disturb the system's normal function and drive it out of its normal performance is shock. How we can divide the shock? By their nature, severity, duration, or frequency. But in the health system, as we are dealing with a very complex system and the atmosphere is very dynamic, we just focus on 2 opposite sides of this classification, like acute sudden shocks that happen occasionally and chronic structural stress that systematically affect the function of the health system. In the definition related to the resilience in the health system, in international health policy and management discourse, they mainly focus on the acute shocks, like environmental disaster and infectious disease outbreak. In our work, we mainly focus in infectious disease outbreaks. So from now on, when I'm talking about a crisis, a critical situation, or a shock, I mean infectious disease outbreak. I wanted to talk about 3 highlights. First, shock, then performance and characteristics. Let's now move to the performance. During a period of time, a health system has more or less a stable performance. Then when a shock happens, this performance starts to decrease. The slope of this decrease varies from system to system and depends on many factors. Then the system starts to stand in front of the shock and maintaining its performance. This disturbed state, this time of disturbed state, really depends on the strategic plans of the system and infrastructures. Then after that, the system starts to improve the performance. Because of the burden that the system tolerates during the shock, normally it cannot go back to its regular performance. So here it is, what we are talking about, resilient health system. The definition was the ability to absorb, adapt, and transform the shock to maintain the performance, exactly what we want. So from the time that the shock happened to the time of post-recovery, the system suffers a lot from the burden of the shock. Like what? Overcrowding and excessive waiting times, or shortage of resources, increased patient mortality, or decreased patient and staff satisfaction and inefficient use of resources. All of these issues can make problems in the process and flows of the health system. As much as we can shorten this time, so the system suffered less. With the help of resilience in the health system, we can suffer less and recover sooner from the shock. But knowing about the health system resilience is enough? Of course not. So what is the right approach? Like any other approach that we need to improve the performance of the health system, we cannot implement this approach suddenly, all at sudden to the system. We need to do it stage by stage to implement it comprehensively in the system and have the maximum result out of it. But what are those stages? First, preparedness. What do I mean by being prepared? Well, resilience approach has its roots in the organizational culture. So if we want to make our organization convinced to accept the new approach related to the resilience, we need to prepare them. We need to train them in advance. Also, we need some infrastructure for the resilience in advance. And after that, it's important to know the shock and notify it on time. What does it mean? So when a natural disaster happens, we can feel the shock. Some other shocks are predictable, like H1N1 flu, that we know the peaks. But some of the shocks, we need to understand them, like what happened in the COVID-19 based on the patterns in Wuhan, China. They could understand the shock, and it's important to alert these shocks on time to the system. And then there is, of course, some indicators that need to be measured and monitored. Indicators related to the resilience. And then based on these feedbacks, we need to apply some managerial changes, and then, of course, recovering and learning from this. But none of these approaches can be applicable unless we know the characteristics of the resilience. The third highlight that I mentioned during the definition of the resilience. What are the characteristics of a resilient health system while exposed to a sudden shock? Well, we did a systematic literature review, scoping literature review to understand these characteristics. We understand that there is no definition related to the dimensions of health system. These definitions are unclear. These dimensions and indicators vary from system to system according to the specific shock that they face to them. And there is no theoretical framework that is commonly accepted, including a standard set of indicators and flexible enough to be adapted to different health systems. So by our literature review, which is at the moment under review, and we are going to present it in the 15th APH conference, Berlin, Germany, the next month, we could find 53 characteristics by reviewing the works related to the health system resilience. I just want to highlight that we are not working on individual resilience or psychological resilience. What we are focusing on is just system resilience. We soon understand that if we want to have a control of all these characteristics that we could find, 53 characteristics, we need to classify them. To classify them, we use WHO's 6 building block, which is a commonly used framework for studies related to the performance of the health system. But as now we are talking about the shock, and during the crisis and shock, many errors can happen. We understand that it's better to add another building block to these 6 building blocks called safety, and then classify these 53 characteristics, as you can see here. For example, I explained one of them. By reviewing empirical works related to the resilience of health system, we understand that the system that could provide essential demands, or they had a strategic inventory reserve, they could forecast the shortage, or they could have alternative suppliers, could be more resilient toward different shocks. But what is resilience in the rare and complex disease? Before going to this, I want to remind you a memory. The spread of COVID-19. COVID-19 started in Wuhan, China in 2019. But short after that, the virus spread all over the world, and we could hear that many systems all over the world were under pressure because of this virus and the shock that this virus could bring for them. We can read in the literature that the health system had problem with resource availability, adequacy, and allocation of the resources. They had some financial issues, managerial ineffectiveness, lack of concrete guidelines, specifically in the beginning of this big shock, and occupational stress. As you are working in the health system, I suppose that you also experience some of these problems or also more. We all know emergency department as the front line of dealing with COVID-19. But we also know that other departments that offering treatment to people had experienced some disturbances. In the literature, there were various proposals to improve the resilience of specific departments based on surveillance, flexibility, financing, planning, policy making, and so on. But there is no general framework. There is no specific characteristic related to the rare and complex diseases in the literature. While the treatment of these kind of diseases are very important because the treatment is usually very complex and the continuity of the treatment is important. Also, the patient that receiving these services, this treatment has a specific needs. It is also important to design ad hoc healthcare policies and define the most appropriate managerial tools to cope with future similar emergencies. Based on this, we define our objective to assess health system resilience, taking the lens of rare and complex diseases, with the objective to find specific factors which is important for the rare and complex diseases. What we are doing exactly in this research and how you can contribute. Well, we read a lot of books, we know a lot of theory, we reviewed a lot of empirical work, so we have a lot of theory in our hand. What we usually traditionally do is that we make a theoretical framework, apply it in the practice. But as we said before, in the health system, the system is very complex and the atmosphere is very dynamic. That's why most of the performance tool face to failure doesn't work well. What we are going to do here, we want to use your experience, your data, what you really experienced during this period, using your knowledge and bring it back to our model. So we want to adjust this theory based on also your knowledge. And as a result, we are going to have a practical tool to use. So how can we contribute to broaden the knowledge in this context? Be part of this study and help us with your experience, with your knowledge. This is very valuable for us to use what you really experience in this field during this hard period, so we can use it to adjust our theory. We are going to address three main questions. First, what are the characteristics that match well in practice in the field of rare disease? We are searching for the characteristics which is specifically for this concept. Moreover, as we are in an ERN, in a big group, we want to know that receiving internal support is helpful. Being in a big network is helpful to coping, to be resilient in facing a critical situation. And also having a pathway make the system more resilient or not. We are going to discuss this work also in this work in the eSport Europe 22 in a couple of weeks. So we have three main questions, one survey to answer. We are asking you to be part of this work and answer our survey. What we expect to have. we want to find a comprehensive set of determinants that are appropriate for this field, not general, for this field, in the context of rare and complex diseases. And we want to compare this set with the literature, what we could find in the literature. So we want to generate a framework specifically for this field. And how is our survey? Well, if you click on the link, you can find this page. The survey may look a little bit complex, but it's not. It takes just 15 minutes. If you specify 15 minutes, you can fill it. I explain it more. In the first page, I explained what I explained in this webinar. In the second part, you can see the social demographic part, which is very common. And then we have 7 domains. These 7 domains are those 7 building blocks that we talked about them. For example, in the domain 5, we have information block. We could find some characteristics by reviewing the empirical works. So we want to understand how these characteristics could help your system based on the experience that you had during the COVID to be resilient. Does it really work in your field or not? Or domain 7 is safety, which is shorter. We had less characteristics. Then we ask you to rank the building blocks based on their importance, asking you about being part of a large network like ERN. And then, which is very important, if you know any other characteristics in your field that we couldn't find it by reviewing the literature, please tell us. We will consider that. It's very important for us to know what we couldn't find in the literature. How you can access this survey? You can click on the link that we provide for you or scan this QR code to answer the survey. And we finish, feel free to ask any question. Thank you so much for your attention.